Hello everyone, today we're delving into the topic that could quite literally be a matter of life and death: how to know if you're having a heart attack. This video is of utmost importance because understanding the signs and symptoms of a heart attack can make all the difference in seeking timely medical attention and saving lives. Number 1. Chronic fatigue feeling. Chronic fatigue, or an overwhelming sense of tiredness, can indeed be a symptom of a heart attack. While it is important to distinguish between general fatigue and the specific fatigue associated with a heart attack, the latter often presents an unusual and extreme exhaustion. This symptom may be more pronounced in women, and it can occur during the heart attack itself and in the days or weeks leading up to it, as the heart struggles to pump blood effectively. The fatigue might be so severe that it can disrupt daily activities, making it a concerning red flag. If you experience persistent, unexplained fatigue, particularly when accompanied by other warning signs like chest pain, shortness of breath, and nausea, it's crucial to seek immediate medical attention. Recognizing these symptoms early on could make all the difference in preventing a potentially life-threatening cardiac event. Experience the future of footwear with our innovative shoes. They're water repellent, so your feet stay dry in any weather and easily washable to maintain a fresh look. Enjoy unmatched comfort with breathability that keeps sweaty feet at bay, and say goodbye to odors thanks to the unique wool surface that resists bacteria. Step into the future with Giesswein, where innovation meets comfort. Click on the link below to upgrade your footwear today. Number 2. Chest discomfort. Chest discomfort is one of the most recognizable and critical symptoms of a heart attack. The sensation often feels like a crushing pressure, fullness, tightness, or pain in the chest area, typically behind the breastbone. It can be persistent or come and go, lasting for several minutes or more. The discomfort might radiate to the neck, jaw, shoulder, back, or arm, particularly the left arm. It's essential to know that not all chest pain or discomfort is indicative of a heart attack. Still, any unexplained or intense chest discomfort, especially when accompanied by other symptoms such as shortness of breath, nausea, or lightheadedness, should not be ignored. Prompt medical attention is crucial, as early intervention significantly increases the chances of a positive outcome and minimizes potential damage to the heart muscle. If you or someone you know experiences these symptoms, don't hesitate to call for emergency assistance immediately. Before we move on to the next one, like and subscribe to have a physically fit body like this. Number 3. Cold sweat and dizziness. Cold sweat and dizziness are alarming signs, often associated with a heart attack. When a heart attack occurs, the body can react by activating the fight or flight response, leading to the release of stress hormones like adrenaline. This can result in excessive sweating, even if you're in a cool environment, and a feeling of lightheadedness or dizziness. The cold sweat is often described as clammy and more profound than typical perspiration, and it's typically accompanied by a sense of impending doom or anxiety. These symptoms are concerning because they indicate that the heart is struggling to pump blood effectively, depriving the body of oxygen. If you or someone you know experiences cold sweat, dizziness, or a combination of these symptoms, along with the other signs like chest pain or discomfort, difficulty breathing, or feeling nauseous, it's essential to call for emergency medical help immediately. Number 4. Insomnia and sleep apnea. Insomnia and sleep apnea can be warning signs of an impending heart attack. Chronic sleep disturbances, particularly in the form of insomnia or sleep apnea, can significantly strain the cardiovascular system over time. Insomnia, characterized by difficulty falling asleep or staying asleep, can lead to increased stress and elevated blood pressure, both of which are a risk factor for heart disease. On the other hand, sleep apnea, where breathing repeatedly stops and starts during sleep, can result in oxygen desaturation and put extra stress on the heart. These sleep-related issues can contribute to the development of atherosclerosis and other cardiac problems. If you're experiencing persistent sleep problems or suspect sleep apnea, it's crucial to consult a healthcare professional for evaluation and management. A fit body is essential to stay away from heart attack. Click on the icon to know the secret exercise to transform your body in 3 weeks. Number 5. Anxiety and depressed feelings. Anxiety and feelings of depression can be unexpected, yet significant symptoms of heart attack. While chest pain is a classic indicator, the emotional and psychological responses to a heart attack are often overlooked. When the heart muscle is deprived of oxygen and blood, it can trigger intense anxiety, fear, and a profound sense of impending doom. Some individuals may experience feelings of extreme sadness and hopelessness, which can mimic depression symptoms. It's essential to recognize that these emotional responses are not solely due to psychological factors, but are physiological reactions to the heart's distress. If you or someone you know experiences sudden and unexplained anxiety or overwhelming feelings of depression, it's crucial to seek immediate medical attention. Number 6. Swollen ankles. Swollen ankles can serve as a subtle yet important symptom of a heart attack. The symptom occurs due to the heart's inability to effectively pump blood, which can lead to fluid accumulation in the body, particularly in the lower extremities. When the heart is compromised, it struggles to maintain proper circulation, causing fluid to pool in the legs and ankles, resulting in swelling. If it's related to heart issues, there will be swelling in both legs. Swelling due to heart issues is often bilateral, affecting both ankles. Recognizing the sign is crucial because it can indicate a serious cardiovascular problem, and seeking immediate medical attention can help diagnose and address the underlying heart-related issue, potentially preventing a more severe cardiac event. Number 7. High cholesterol. High cholesterol itself is not a direct symptom of a heart attack, but it is a significant risk factor for heart disease, which can lead to a heart attack. Elevated levels of cholesterol in the blood, particularly low-density lipoprotein cholesterol, contribute to the formation of plaque within the arteries. Over time, this plaque can narrow the arteries and reduce blood flow to the heart, increasing the risk of a heart attack. While high cholesterol is a silent condition and does not typically produce noticeable symptoms, it is a key contributor to atherosclerosis, a disease characterized by the buildup of fatty deposits in the arteries. Atherosclerosis can progress silently until it suddenly causes a heart attack, usually triggered by a rupture or a blockage in one of the plaques. Monitoring and managing cholesterol levels through lifestyle changes and medications is vital in reducing the risk of heart disease and potential heart attacks. Number 8. Bloated feeling. A bloated or a full feeling is not a typical symptom of a heart attack, but it can indirectly be linked to this life-threatening event. During a heart attack, blood flow to the heart muscle is compromised due to the blockage in one of the coronary arteries. This reduced blood supply can lead to various symptoms like chest pain, shortness of breath, and cold sweats. Sometimes these symptoms can cause a sense of discomfort, fullness, or indigestion, which may be mistaken for bloating or a gastrointestinal issue. It's important to note that heart attack symptoms vary among individuals, and they don't always follow the classic pattern of chest pain. If you experience unexplained discomfort or unusual sensations in your chest, upper body, or abdomen, especially if accompanied by other potential heart attack symptoms, it's crucial to seek immediate medical attention. Number 9. Left shoulder pain. Left shoulder pain can indeed be a concerning symptom of a heart attack. This discomfort often arises due to a referred pain, where the brain interprets heart-related pain as originating in the left shoulder or arm. The heart and the left shoulder share some nerve pathways, which can lead to this perception of pain in a distant location. During a heart attack, the heart muscle is deprived of oxygen and begins to suffer damage. This process can trigger pain that radiates to the left side of the body, particularly the left shoulder, arm, and sometimes the jaw. While left shoulder pain may occur alone, it's often accompanied by other symptoms like chest pain, shortness of breath, and cold sweats. If it is a sudden pain, then you should get it checked. Number 10. Shortness of breath. Shortness of breath is a critical and often unmistakable symptom of a heart attack. During a heart attack, the heart muscle is deprived of oxygen due to a blocked coronary artery, and this can lead to a sensation of breathlessness. This symptom is typically accompanied by other warning signs like chest pain or discomfort, often described as a heavy pressure on the chest. Shortness of breath during a heart attack can manifest as difficulty breathing, a feeling of suffocation, or rapid, shallow breaths. The body senses the oxygen deficit and responds with this distressing symptom. If you or someone around you experiences sudden and unexplained shortness of breath, especially when coupled with other potential heart attack symptoms, it is imperative to seek immediate medical help. Your health and well-being should be your top priorities, and we hope this information empowers you to make informed choices in the face of a potentially life-threatening situation. Remember, time is of the essence during a heart attack, so don't hesitate to call for immediate medical help if you experience any of these symptoms. Staying fit is very important to reduce the risk of a heart attack, so watch this video on how to lose belly fat at home for boys.